Hello everyone, this is Keithan from MedMinds and today we are going to learn about the pathology of amyloidosis. So what is amyloidosis? Amyloidosis is a generic term for the disease that happens when the proteins are getting misfolded and they accumulate in our body and cause functional damage to us. That is the simple definition. So why should we learn about amyloidosis? If it's not diagnosed earlier, the prognosis of amyloidosis is very poor and the average median survival of a patient with amyloidosis is only 2 years. So that's how important it will be. So what is the mechanism of amyloidosis? First, there will be light chain proteins or the normal proteins, and suddenly there's proteolysis or altered amino acid sequence. And then the proteins start getting misfolded by themselves and they form oligomers. Oligomers are already very dangerous. And then they form amyloid fibrils. Amyloid fibrils are the main villain in our story. Amyloid fibrils then cause disruption of the architecture and tissue damage. Amyloid fibrils will just accumulate in our body and won't let our organs function normally. And then next, the types of amyloidosis. There's first AL, ATTR and AA. So what is AL? Actually called primary amyloidosis, and this L is actually Ig light chains. So Ig light chains get accumulated and they form AL protein. This AL protein is getting misfolded and it will cause aggregation, which will cause amyloidosis. Like that, we can see ATTR. ATTR is actually the short form for transthyretin. TTTR is transthyretin. So what is transthyretin? Transthyretin is a protein that binds and transports the thyroxine and retinol binding protein. And then when it gets accumulated, it causes ATTR, WT accumulation and then aggregation and amyloidosis again. And then AA. So the mechanism of ATTR and AA are actually quite similar. It starts in the liver, and then for AA, which is the serum amyloid A protein, that gets accumulated in AA. So liver, IL-1 and IL-6 interferons are released, and then it causes the accumulation of serum amyloid A, which causes AA type of amyloidosis, aggregation and then amyloidosis. The misfolded proteins just accumulate in our body in various organs like the kidney, heart, spleen, liver and tongue. So they cause the functional deformities and won't let our body function well. So the morphology of kidneys in amyloidosis will be first the amyloid proteins that are formed that will get accumulated in the capillaries of the glomerulus, peritubular capillaries, and they will cause the distortion and they won't let the transport of urine correctly in the body. And then next we'll go to spleen. Spleen has two types. There's sago-spleen and Lardaceous spleen. First spleen will go into splenomegaly, and then sago-spleen is the splenic follicles get accumulated with amyloid fibrils. This will cause sago-spleen. Sinuses will be accumulated with amyloid proteins and that will cause Lardaceous spleen. So splenomegaly is the main thing that happens. Then we'll go to liver. In liver, deformities happen because of the amyloid proteins, and then hepatocytes also get damaged, but ultimately there will be no liver damage and liver will be saved so much if we diagnose it earlier. Then to the heart. They will damage the conductive system by accumulating in the subendocardial region of the heart, and also they will accumulate within the myocardium and stop the conduction system. Then tongue. In tongue, they will cause macroglossia that will enlarge the tongue and it will lead to speech disturbances, and also like we can't digest food properly. So then the clinical features of amyloidosis. First, there will be like non-specific symptoms like syncope, weight loss or weakness. By then we won't be able to diagnose, but next there will be cardiac, renal, GI, tongue and vascular deformities that are going to start because of amyloidosis. So what are the cardiac causes? Conduction disturbances and arrhythmias which are starting to come because of amyloidosis. And then there will be chronic constrictive pericarditis in cardiac thing. Okay, then renal. If we go to the renal involvement is actually very dangerous and it will actually cause proteinuria and albuminemia, and it is the most affected organ in amyloidosis. Then we can go to the GI tract. Malabsorption, diarrhea and whatnot. The tongue, as I said earlier, it will cause macroglossia and speech disturbance, which will also lead to improper digestion of food. So GI tract will receive less food than before. Then vascular deformities. In vascular deformities, the accumulation of fibrils causes vascular fragility, which will lead to the breakdown of vascular vessels. So the diagnosis should be done very soon, and the special stain that is used is called Congo Red stain. If we are using eosinophilic or eosinophilic stain like H&E stain, amyloid will appear as amorphous and hyaline. Okay, so this is what we should remember about amyloidosis, and early detection is very important. Immunoelectrophoresis can be done, and then bone marrow aspiration can also be done. For the Congo Red stain, we need the abdominal fat aspirates to use the Congo Red stain because it will be the most helpful diagnostic factor. And then we can do scintigraphy with radio labeled serum amyloid P, which will be helpful for the diagnosis of amyloidosis. So after this, just take a read in your book, and I think it will be more easier than you expected. Thank you.